Now, last year, only 40% of Utahns chose to get their flu shot. We're hoping that that number goes up this year, especially because we're battling COVID at the same time. I want to bring in Dr. Randall Likes. He is an ER physician at Timpanogos Regional Hospital. Hi, Dr. Randall. How are you?
I'm doing well. Thank you.
Good. Glad to have you here. Now, let's talk about this because I think the big concern is, too, how the flu is going to coincide with COVID this year.
Yeah, that's a very concerning thing that I think the healthcare providers and scientists both are really unsure of how this is going to interact. Certainly, it's not going to make things better, and there's a potential that it could actually make our respiratory system season that we have in the winter already much, much worse than it's been in seasons past.
Exactly. If you're battling two respiratory viruses at the same time, we have no idea what's going to happen. So the importance of getting them this year, obviously much higher. I've had mine. In fact, my family and I were texting last night to make sure that we had all had them. And with Governor Herbert addressing us this week and now the mask mandate in place, I think some people out there are still like, I don't want to wear a mask. I'm not going to do it. Why, from your perspective, should everyone be wearing a mask?
Well, one of the few things that's been shown to help prevent the spread of COVID is proper mask wearing. And I think you need to look at it from a couple different perspectives. One is, any mask is better than nothing, but try to get a mask that's appropriate. And secondly, I think having the mask on also gives you the appreciation for also trying to remember the social distancing. And so I think that is another big part of having the masks and not just the mask itself.
I also think it's become a sign of respect. We're all trying to help each other through all of this. And, we're in it together, right? It's the cliche line that we've been saying all year long, isn't it?
Absolutely. And, as far as the flu goes, we've kind of pushed the high-risk individuals getting the flu vaccinations every season. I think this year, anyone and everyone that can get the vaccination is going to be a big bonus to try to prevent the co-infections with the COVID and the influenza this season.
And when we talk who should be getting it, what age is up?
So you can start very young and all the way up to the very old. In the past, it's been the younger kids, the pregnant ladies, and the elderly. But I think this season, it's going to be important for as many people as possible to get vaccinated.
So take your whole entire family, make a day of it, go to the hospitals or the Instacare, wherever you go together and get those shots for all of us. Dr. Randall, thank you so much for being with us and for all the information. Stay safe and stay healthy this season.
Thank you very much. My pleasure.